Hi, my name is Anika Majaria and I am at the American Hospital with Dr. Ammar Safar, President of Medical Staff and an ophthalmologist. Hi, how are you doing today?
Hi, hello.
Could you please introduce yourself and talk to me a little bit about your specialization?
Optometry basically study the science of contact lenses and glasses and how do you apply them to correct someone's vision problem. But they don't involve treating conditions in the eye, whether surgically or medically.
And what are the most common problems you see emerging within the eyes?
That's a very good question. And basically, in Dubai per se, we have a couple of very common diseases because of the population that we have in Dubai. One of the very common diseases in the Gulf area and in the UAE is diabetes. Diabetes, as you know, is a disease that affects the entire body. It doesn't only affect your heart or your lungs or your kidneys. It also affects your eyes, and it's very important that they get that checked. Other common diseases here, mainly related to the weather and related to the fact that there are lots of professionals who work with computers, is dry eyes and irritation in the eye that happens due to the sand or due to the weather in general. And finally, we see quite a bit of patients who have something we call cataract, which is a clouding of the natural lens of the eye that can take place over time, sometimes under the effect of diabetes also, and result in blurry vision.
Can you talk to me about some of the causes for cataract?
One of the things that is very prevalent here is sun. The sun is extremely powerful in the whole Gulf area. So the exposure to the sun is one of the major risk factors for developing a cataract at an early age.
With regards to cataract, is there a way that we could prevent or slow down the process? Because I know you mentioned before that it's inevitable that we actually can get the disease in the first place.
Shielding your eyes from the UV, the damaging part of the sun beam, the UV light is quite damaging to the eye itself. So wearing a good quality sunglasses is extremely important for this kind of prevention. Another very important thing is avoiding things that can really be harmful in your diet and also in the way you conduct yourself. So a couple of very important things are drinking alcohol and smoking.
Are there any specific foods within the diet that help? I mean, I'm thinking sweet potato. I'm not sure if that's one of them.
Sweet potatoes, and everybody asks about carrots, of course, you know, because carrots, everybody think that drinking or carrot juice or eating a lot of carrots will really give them great vision, which is in a way true, but not entirely accurate as well as it's being advertised, actually. One of the major things that I always tell my patients, being a retina specialist, basically try to eat a good amount of vegetables that have green leaves in them, such as spinach, kale, things like that actually are extremely important because they have a lot of the antioxidants that we want to, we buy pills sometimes to take antioxidants. But if you can incorporate these things in your diet in the form of a healthy diet that has these kinds of things. Broccoli is another very important vegetable that's very, very healthy for the eye. Fish oil is extremely important. So lots of these things in a balanced way, just eating a balanced diet, I think you should be fine.
With any of the illnesses or diseases that you deal with, are any of them reversible?
That's an excellent question. Most of them are reversible, actually, which is a great thing for people to hear. Things that are not reversible are things typically that we are born with, congenital defects, issues that were a problem from birth.
Thank you so much. That was a really great answer, and it was lovely having you here today.
Thank you so much, Nikki, and thank you for having me, and welcome to the American Hospital.
Thank you so much.
Thank you so much.